Chronic pain patients tell News 4 they are innocent victims of the opioid epidemic.
Yes, some are now struggling to get the medicines they say help them live normal lives. Investigative reporter Lauren Traeger has been looking into why that is.
There's just days I barely make it back up the steps.
Sandy Hayden's been in horrible pain most of her life.
When I was a teenager, I had colitis.
She's had multiple surgeries, including losing her large intestine.
The pain is there every day. I have a lot of scar tissue.
I'm in pain 24/7 every day of the week.
James Overholtz's back pain is sometimes disabling.
I can't live in pain like that.
Both say opioid pain medication helps them live normal lives. For Sandy, it's methadone. She calls it her miracle pill.
It actually killed the pain. Methadone, I didn't even know about methadone. And they gave me that, and I started having a better quality of life.
But now she is worried her miracle may be ending. Her doctor has cut her daily dose, saying he has to because of new regulations.
The mornings are just non-functional.
James uses oxycodone. Recently, he couldn't get his pain meds at all because a pharmacist refused to fill his prescription.
Well, what's the problem? Why do you have to talk to my doctor?
That was at the Walmart in Glen Carbon.
He made me feel like I was being ostracized, or I was a criminal, or I was doing something wrong.
Both James and Sandy say ever since the heroin epidemic took hold, they are being treated differently.
Do I look dangerous?
It's getting much more difficult for chronic pain patients.
Pharmacists we talked to say they feel for Sandy and James.
10 years ago, a patient comes in, great, hey, how you doing? New customer, new patient, new prescription, sure, we'll take care of you, no problem. But now, with the opioid crisis and the possibility of overdosing, it's a tough situation.
Pharmacist Stephen Clement says with so many people dying from drug addiction, they're doing a difficult balancing act.
We are the ones basically making the determination of whether that patient is going to get their prescription or not based on what we see.
I have here many patients complaining similar things.
Dr. Jang-Hwa Chung spoke with us from Cleveland. He's president of the American Academy of Pain Medicine. He says that like patients, medical professionals are caught in the middle.
The physicians are pressured.
But he says addicts and chronic pain patients are two very different populations. Drug addicts tend to be between the ages of 25 and 45, he says, while chronic pain patients are more likely to be 50 or over.
We're there to be able to try to have quality of life. And I think that a lot of people are being shut out.
James and Sandy say they just want to draw awareness to the sometimes overlooked victims of the opioid crisis.
It makes me angry.
They say that for some chronic pain sufferers, life without their medications may not be worth living.
They take it away altogether, I might as well die.
Experts tell us that strong training for pharmacists and doctors on how to handle sensitive conversations with patients is really critical in this issue. As for the refusal by Walmart to fill James's prescription, Walmart tells us they expect all customers to be treated with respect and say they're looking into the situation. I'm Lauren Traeger, News 4 Investigates.